What diet recommendations does the National Institute on Aging suggest for dementia prevention? Have you ever wondered how your diet might affect your brain health as you age? The National Institute on Aging has some valuable insights. They recommend following the MIND diet, which stands for Mediterranean-Intervention for Neurodegenerative Delay. This diet combines elements from both the Mediterranean diet and the DASH diet, both of which are known for their heart health benefits, while also focusing on foods that may help protect your brain. So, what does the MIND diet include? First, it emphasizes green leafy vegetables like spinach, kale, and collards. These are packed with vitamins and antioxidants that are great for brain health. Other vegetables are also encouraged for their fiber and essential nutrients. Berries, especially blueberries, are key players too. They contain antioxidants called anthocyanins that are linked to improved brain function. Nuts are another important part of the MIND diet. They provide healthy fats and plant proteins that support both cardiovascular and brain health. Whole grains are included for sustained energy and fiber, while beans offer a good source of protein and additional fiber. Seafood, particularly fatty fish like salmon, is recommended for its omega-3 fatty acids, which are important for reducing inflammation and maintaining brain and heart health. Poultry is suggested as a lean protein source, and olive oil is recommended as the primary cooking fat, providing heart-healthy monounsaturated fats. If you enjoy wine, moderate consumption of red wine is optional. On the flip side, the MIND diet advises limiting certain foods. These include red meat, butter and margarine, cheese, sweets, and fried or fast foods. Research shows that following the MIND diet closely can significantly reduce the risk of developing dementia. In fact, studies indicate about a 25% lower risk for those who adhere to the diet for 10 years. While this does not prove causation, the focus on plant-based foods, healthy fats, and limited processed foods is believed to improve cardiovascular health, which in turn supports better blood flow to the brain and overall cognitive function. For practical steps, the National Institute on Aging encourages older adults to regularly include leafy greens and berries in their meals. They should also incorporate whole grains, nuts, beans, and fish. Using olive oil as the main fat source is advised, along with limiting foods high in saturated fats and added sugars. Maintaining a balanced diet ensures adequate intake of key nutrients like potassium, calcium, vitamin D, and vitamin B12, all of which support brain and overall health. These dietary recommendations align with broader health advice for aging adults, emphasizing nutrient-dense foods that support immune function, bone health, and cognitive abilities. It is always wise to consult healthcare providers or dietitians to tailor these recommendations to individual health needs. The MIND diet is a scientifically supported approach that focuses on brain-healthy foods while limiting harmful ones, contributing to better memory and cognitive health as we age.